The coronavirus has changed life as we know it, including how we work. It's impossible to turn on the TV, browse on our smartphone, or listen to a podcast without hearing about the COVID-19. As healthcare workers, especially since we work with a specific vulnerable population, it is really important that we know as much as we can about COVID-19, how to prevent it from spreading, and how to best care for ourselves and our patients. In this training, we are going to learn about the SARS coronavirus, or novel coronavirus, the virus that causes COVID-19 disease. More specifically, we are going to learn how it can affect us, our patients, and the work we do every day. COVID-19 is a novel or new disease. That means that we haven't seen it before 2019. This newness is why we've been getting conflicting and sometimes confusing information about the virus. Scientists, researchers, and physicians are still learning new things about it every day. The information for this course relies on authorized sources, the Centers for Disease Control and Prevention, as well as the Centers for Medicare and Medicaid Services. Let's sift through the newest information together. What is COVID-19? COVID-19 stands for coronavirus disease. It is caused by the novel coronavirus discovered in the Wuhan province of China in late 2019. Since late 2019, this coronavirus has been spreading throughout communities across the globe. COVID-19 presents with a variety of symptoms, including fever, cough, body aches, fatigue, loss of taste or smell, and shortness of breath. How is the virus spread? The coronavirus is spread from person to person through respiratory droplets. These droplets are transferred from infected person to others through sneezing, coughing, talking, or even singing. People who are closer than 6 feet to one another are at a higher risk of passing the virus through these droplets, especially if they're closer than 6 feet apart for more than 15 minutes. What about asymptomatic people? Not everyone who has the coronavirus shows these symptoms. These people are asymptomatic. This means they do not have symptoms of the disease or have very mild symptoms. People do not need to have symptoms of COVID-19 in order to spread the disease. Asymptomatic people can spread the virus just as easily as someone who has symptoms. How does the coronavirus affect my job as a caregiver? Older adults and those living with chronic medical conditions like diabetes or COPD are at a higher risk of suffering severe consequences, including death from coronavirus. Older adults and those living with other medical conditions are the people we care for every day in their homes. This means we have to protect them. How can we protect our patients? By keeping the virus out of their homes, as well as being able to identify the symptoms of COVID-19 so they can get the best treatment possible. First things first, let's talk about how to prevent the spread of coronavirus. We must social distance, wear masks, and practice good hand hygiene. We'll learn more about these tactics throughout the course. We can also protect our patients by being observant and identifying any possible warning signs of COVID-19 in us or our patients. Signs include fever, cough, and shortness of breath. How long will all of this last? It's so easy to feel frustrated and anxious about the coronavirus. We all feel the pressure of the uncertainty of the situation and the need to change our daily work routines. However, right now, we must focus on our own health and the health of those we serve until there's a viable treatment or vaccine. And even then, we will still need to be diligent about our infection control habits. During the rest of our time together, we will learn about COVID-19, including how to protect ourselves and our patients, how to prevent infection, and what to do if we notice symptoms of the virus.